How can you tell if rectal bleeding is from diverticulitis? Imagine suddenly noticing blood when you go to the bathroom. It can be alarming, but understanding the signs can help you figure out what might be going on. When it comes to diverticulitis and rectal bleeding, things can get a bit tricky because they are related but different conditions. Diverticulosis is when small pouches form in your colon wall, and most people don't feel anything. But if those pouches become inflamed, that's when diverticulitis happens, which can cause abdominal pain, fever, and sometimes bleeding. Diverticular bleeding usually shows up as sudden, painless rectal bleeding. The blood is often bright red or a deep maroon color and may come out in large amounts, sometimes as clots. Because it's painless, many people are surprised by how heavy or quick the bleeding can be. This type of bleeding can be quite sudden and may lead to feeling dizzy or weak if a lot of blood is lost. To tell if the bleeding is from diverticulitis, doctors look at several clues. First, they consider the nature of the bleeding. If it starts suddenly and is heavy, it could be from diverticular bleeding. They also check if there's abdominal pain or fever, which are common signs of diverticulitis itself. However, the bleeding in diverticulitis is often painless, so if you experience a sudden gush of bright red blood without much pain, it might be from bleeding related to diverticulosis that has become complicated. Medical professionals will perform tests to find out the exact cause. A physical exam, blood tests to check for infection or blood loss, and imaging studies like a QRT scan are common. A colonoscopy might also be done to locate the bleeding source and rule out other issues. It's important to remember that not all rectal bleeding is from diverticulitis. Other causes include hemorrhoids, polyps, or other gastrointestinal conditions, so seeing a healthcare provider promptly is essential. If you notice rectal bleeding, especially if it's heavy or sudden, seek medical care right away. Do not try to diagnose or treat it yourself. Managing diverticulosis with a high-fiber diet can help prevent complications, but if bleeding occurs, medical intervention is necessary. Remember, only a healthcare professional can determine the exact cause through proper testing. While diverticulitis can cause bleeding, the key signs of diverticular bleeding are sudden, painless, and often heavy bleeding with bright red or maroon blood. Always get evaluated promptly to ensure proper diagnosis and treatment.